Could not paying attention to a letter potentially cost you thousands of dollars? Unfortunately, yes. What exactly is this letter? Let's get into it. Today, I am enjoying a glass of cab while talking to you about ANOCs. All right, so cheers. First and foremost, I just said ANOC. What is that? So an ANOC letter is your annual notice of change. And you generally receive this from the insurance company in which the plan that you're enrolled on in September. Whether you're on a Medicare Advantage or a Part D drug plan, you'll receive this by September 30th. I generally recommend that around the time Labor Day hits that you start paying attention to your email or your mail. Frankly, if you get this in the mail, it's going to be fairly thick. So, you'll know when it comes. It's one of those large statement looking type things. It's generally pretty thick, a lot of pieces of paper. And what it's going to do is list the plan changes. So things like any premium changes, any copay changes, drug coverage, doctor or pharmacy networks. These really are things that you might love your plan for this year, but your plan might be changing for the next year. Right around the same time, the annual notice of change, you'll also receive, instead of an ANOC in the mail, if for some reason, and this doesn't happen frequently, but let's say maybe your plan's going away for the following year, you'll get that in the mail in the same time. So I always recommend people on Medicare plans really keep an eye on your email box or your mailbox during the month of September. So, how can this really cost you thousands? Well, first and foremost are prescription drug changes. So plans may drop medications or move to a higher tier. And we do have other videos about tiers and formularies, but as a quick reminder, a tier is essentially the level of which the drug is, which corresponds with how much you pay. So let's say you were previously on a low tier cheap drug and they're raising it to a higher tier, you might be spending more on that drug for the next year. So plans may drop medications, move them to a higher tier. If a plan drops the medication from the formulary or essentially the list of prescriptions that they cover, you could be responsible for the full retail cost of that drug if you don't realize that and don't switch plans during the annual election period. So unless you switch to a plan that covers it, you could be in some trouble there. It can happen with brand name or with specialty drugs. A covered drug that was $10 a month, this is a good example. A covered drug that was $10 a month in 2025 could move to a higher tier and be upwards of $300 a month in 2026. It really depends on the specific drug, the way that the insurance company is looking at the drug, what's going on with the drug manufacturer, et cetera. So this could be all the way, it could create, you could get up to that $2,100 out-of-pocket max limit in 2026 on the prescription drugs. It's just really important every fall that you check out the ANOC to see what the changes are and to make sure that all of your drugs are still covered at an advantageous way for you on your prescription drug plan. All right, couple other things that will be included in your ANOC and one that won't be. So doctors and hospitals, this, from a network perspective, this is probably the most important thing in addition to prescription drug costs that you check out every fall for your plan, but that is not included in your ANOC. So let me come back to this one. The next thing that will be included in your ANOC that you'll receive in the month of September is information on copays or coinsurance. If your plan is increasing specialist copays, hospital stay copays, outpatient services, etc., any of these $20 increases per visit, they can add up if all of them are increasing by 20. Inpatient hospital copays, they can go anywhere from $200 to $400 a day. It's really important that you check out what you could potentially use in a plan and what's important to you and see what the changes in those copays or coinsurance are. As a reminder, copays are generally flat dollar amount. Coinsurance is a percentage that you would pay. Personally, I despise percentages because when it comes to medical, you just never know what it's going to be a percentage of. So last, premium hikes. This is important here. Essentially, if you see a $30 a month increase in some premium, that could be, well over, it's $360 a year essentially. So these things do add up quickly. This is common in a standalone Part D drug plan. Some Medicare Advantage plans can add or change premiums as well. It's just something to be aware of, and it's worth reading your ANOC for these reasons. Now, I did mention earlier that doctors and hospitals network updates are not included in the ANOC. They should be, but unfortunately they're not. So it's critical that if you're on a Medicare Advantage plan, that you're checking every single year to make sure there's been no change in the network so that you can still go see the doctors that you prefer and the hospitals that you prefer. The last probably 3 to 4 years, there's been a lot of network disruptions throughout the country. So this is really important. If you ignore, the information included in your ANOC for the copays and the premiums, you're just going to be spending more. But if you ignore checking out the doctor or the hospital, you might not be able to see the provider that you've seen for years. So this is pretty important. One thing before I kind of go with what to look for, a lot of people ignore this ANOC, or, it's just a mistake not to take a look at it. Many mistake it for junk mail because it is thick, or it will be in your email. There will be, fine print. I don't love reading something with a lot of writing that comes to the house if it's not a book or a newspaper. But some people assume if you don't do anything, nothing will change, but that's definitely not the case. My grandpa has since passed, but he used to get this every year and would just tear through it and tell me all about what he read in his ANOC. And, when your granddaughter's in this industry, you really don't need to be doing that. But, take one from Grandpa Joe and go ahead and take a look at this. So really what I recommend you take a look at as we continue are the monthly premium changes, copays and coinsurance, changes to your drug list. Again, network updates won't be in the ANOC, but I recommend you look at that every single year to ensure that you can still have access to your preferred providers. And any added or removed benefits would be listed in your ANOC. That's important. What to do if you see a big change. First, don't panic. You have options. You're going to receive this in September, and starting on October 15th, you can select another plan for the next following year. Then, if you don't make a change, there's also the open enrollment period, the first quarter of the year, where if you're on a Medicare Advantage plan, you could switch to another one. So you do kind of have that safety net if needed, but I would really recommend you just check out your options during AEP. You could switch to a new plan. Like I said, AEP is October 15th through December 7th. And really at the end of the day, what I recommend is that you stay organized. Designate a folder or an inbox for all of your Medicare mail. Don't delay, read the letter as soon as you get it. Talk to an expert, call us, we can help. If our clients are having these issues, you're likely having them as well. If you are our client, we're likely going to update you on what's going on with your plan. And really just be aware of the dates and what applies to you as time goes forward. Knowing when AEP is, when OEP is, when you can make those changes, these are all important things.